So swallowing difficulties can be caused by many things. It tends to occur with age. So as we get older, in common with a lot of things, the swallow mechanism doesn't work quite as well, and we can get what we call esophageal dysmotility, which means the esophagus, the gullet, doesn't really clear the food as well as it used to. Other things that can cause swallowing difficulties are either in the wall of the esophagus, so narrowings, or in the lumen, so in the space where you can get swellings and sometimes even tumours, or things pressing on the outside of the gullet. For instance, large thyroid mass potentially can do that. So there's many reasons why people have swallowing difficulties. And really it's a question of being seen and assessed so we can work out which one it is. So as well as a difficulty swallowing, because the voice box is right next to the swallow, so you can get voice problems. Sometimes if things keep going down the wrong way, you can get cough and choking and even chest infections if food goes down the wrong way and gets into the lungs. So there's a lot of associated problems that people can get if the swallow mechanism fails to work as well as it might. So swallow difficulties can be from the minor, that means no treatment, right through to really serious things, right down to cancers of the esophagus, the gullet, or higher up in the airway. So they can be serious. And really it's a question of, if the swallow difficulty is bad and nothing's going down, then really do need to consult a doctor. If the swallow becomes really bad, then of course you can't swallow anything, you can't get any food or liquid down, then that is a really serious problem, because no one can survive without being able to eat and drink. And that's when you really need to be consulting your doctor and referred on to the appropriate specialist. So this starts right in the clinic. So in the ENT clinic setting, we've talked to you about why the swallow has happened and what sort of symptoms you're getting. The first and most simple test is to use a little telescope that goes down the nose into the throat, so you can look at the top end of the swallow mechanism and the voice box and all surrounding areas. Where we go from there really depends on what the symptoms are suggesting. We can do x-rays such as the barium swallow, where you drink a radio opaque liquid and take pictures to outline the gullet and the rest of the swallow mechanism. We can do a full endoscopy where we have a look down with a bigger scope that goes all the way down to the tummy. We can do a general anaesthetic and have a look round that way. So it largely depends on what we're trying to find, what we think the problem may be. So it is possible to treat swallow problems, and this largely depends on the cause. So the simple things like esophageal dysmotility, if it's not too bad, simple reassurance. We can ask our colleagues in speech therapy, who as well as being speech therapists, are speech and swallow therapists, so they can help with the swallow. If there's a narrowing in the gullet and esophagus, potentially you can divide it, stretch it, treat it. If there's a thing called a pharyngeal pouch, where you get a little outpouching, food collects and get regurgitation, that's relatively straightforward to treat sometimes, right through to the cancers of the gullet, esophagus and higher, which we will assess properly and treat appropriately.